So the fact that the Queensland government is actually going to put them into law, I think is a great move. I think it's something which we need to ensure is complied with by police, and that the people that are facing these drug diversion programs know that it's a health-based approach that's being taken rather than a criminal law enforcement type approach. So I think that these are very good initiatives.
Why does this make sense as far as you're concerned?
Well, we know, for example, that a lot of people that enter the criminal justice system are chronically dependent on drugs and have quite problematic behaviour that goes back to particularly traumatic early childhood experiences, a range of factors which don't relate to the drug use as such, but really do need to be addressed. And I think, on the other side of that, there are also a lot of people that use drugs and use them non-problematically, and they often get picked up by the police. So the fact that we can have a system now where people get a warning and they are cautioned initially, I think that's a great positive initiative. But I also think too that if they go back into, I guess, the system where they're at the attention of police, that there's that sort of safety net there to get them into treatment, which is often quite critical for a lot of people who have a whole range of problematic type behaviours associated with their drug dependency. So homelessness, mental health, that type of thing. So finding some pathways into the health systems to help them address those underlying issues is quite important. It's really important to get those pathways going.
Historically on this issue, and there's been a push towards this kind of approach for decades, some have argued this would lead to more people using drugs. Is that borne out in the research?
No, there's no evidence for that. And as I said, I was with Victoria Police in the late 90s when we introduced drug diversion programs, and there was no upsurge in drug use. And I was also part of the team that implemented the cannabis cautioning program in Victoria Police in the late 90s. And some of the myths and misconceptions around that is that, if you just go soft on drugs, then more people are going to use drugs. But there's no evidence for that. We don't have any evidence for that. And in fact, when we implemented the cannabis cautioning program, a lot of people said, "Oh yes, we're going to have thousands of people, wanting mental health services, and there's going to be a huge upsurge in number of people using in the community." But drug diversion programs, cautioning programs, do not lead to increased use.
How do different states and territories now compare in terms of their approaches to drug laws?
Well, in terms of the law, pretty much they're all the same, apart from maybe Canberra, which is changing their laws this year to remove criminal penalties for drug possession and use, but other states still have those laws. In terms of drug diversion programs, there's diversion in Victoria, and there's now going to be this new law in Queensland, but other states and territories haven't followed suit. So we would like, I guess, a universal approach towards this, a consistent approach across all states and territories. And I think the model that's being adopted in Canberra is a model that we should seriously consider. I think it's really important that we start to remove those criminal penalties for drug use, which can impact, as was in your story, on people's lives. If you've got a criminal conviction for drug use, it just sets you back in terms of a whole range of things in your life which a lot of us other people don't have to deal with. For example, travel. It can impact on your travel. It can impact on your employment. So getting rid of those criminal convictions, I think, is a really important step.